Well, it's definitely not like the TV shows where you're just coming in this flurry of activity. There's a lot of waiting around. When parents first come in, you get admitted into a room with your nursing staff. There are some safety questions that the nursing staff asks about, and then just general health questions, your overall health, any medical allergies, any plans for your childbirth that you were hoping to implement. What your pain management plan would be, for instance, if you're planning to go with an unmedicated birth or if you were looking for a medicated birth. Having a go bag ready is important, and in the car rather than waiting in a closet for you, because you'll definitely forget it in the closet. So have it in the car is important. Same thing with the car seat. So the one thing I always tell all of my patients to do before the baby comes is go do something that you feel like you're not going to be able to do for a long time.
Hi, I'm Rebecca Weber. I'm a nurse midwife here at Jefferson Einstein. And today we're going to talk about the first 24 hours after birth. Where do I start? There are so many wonderful changes that happen in those first 24 hours. One of the biggest ones that people talk about is what's happening to your body. So after the baby's born, one of the big things that you'll start feeling is that cramping feeling. A lot of times that's called after pains. Your uterus, which was holding a whole baby, is now shrinking back down to the size of a grapefruit. If you've had a vaginal birth, a lot of people tell me, whoa, no one gave me a heads up about how sore or swollen things would be. The other thing that is really important to talk about in those first 24 hours is how you're going to feed your baby. We want to support you in whatever you decide. We are a baby-friendly hospital, so we encourage breastfeeding, and so we really want to put the baby on the breast really quickly after the baby's born, and we can help you with that. So something that we have a lot of times after having a baby is the postpartum shakes. And people are like, I'm shaking, but I'm not cold. Totally normal, and it's all because you just had a baby and your body's going through big hormonal shifts. For both vaginal and C-sections, we always like to make sure that if you had an epidural or any type of anesthesia that wears off well, that you get up moving and everything like that's okay. I always say make sure the first time you stand up that you give yourself lots of grace and go slowly. First I say kind of sit on the edge of the bed, take some deep breaths, and make sure there's someone with you to support you.
I'm Liza Liveright. I am a general obstetrician gynecologist and the medical director of labor and delivery. I'm here at Thomas Jefferson University Hospital, and I'm going to talk about what to expect when you're having a C-section. Some people choose for a C-section right off the bat because that feels like the best plan for them. Some people will have an indication for a C-section before labor. Some twins or other higher level multiples will have planned C-sections, but it's really important that everybody knows that that decision is never taken lightly, and your clinical team is there to have a healthy and safe birth. So this is the operating room table where the patient will be. Everything up here is for our anesthesia colleagues, and so there'll be several people up here with you. And generally speaking, there are two surgeons. So there's an attending level surgeon, someone like me, and then a resident who are important for the safety of the surgery. And so one of us will be on one side, one of us will be on the other side, and we also have other support people. There are two nurses, as well as either a scrub tech or a scrub nurse that's handing us instruments and keeping the flow safe. In some situations, babies do need a minute to transition to the outside world, and they may need to get warmed up. And so it's important to remember that you may not be immediately with your baby after delivery if there's any concerns about the baby transitioning or the baby's temperature. You know, it can feel very overwhelming. There's bright lights, there's lots of people going to be around you, but we're all here for you and your baby.
Hi, I'm Jason Baxter. I'm the chair of obstetrics and gynecology at Jefferson's Abington Hospital. A pregnancy may be deemed high risk because of maternal factors, medical conditions like diabetes or high blood pressure, or based on a maternal age, or it may be based on fetal or baby factors, like a newly diagnosed birth defect. Some pregnancies may be considered more high risk because of past obstetrical experience. In other words, if someone's had complications in a pregnancy in the past, it's best to be prepared. We're sometimes seeing people based on age. Sometimes we're talking to people about minimizing bad habits and focusing on good habits, like healthy nutrition, good hydration, regular exercise, getting a good night's sleep every night, and healthy ways to manage stress. There's sometimes misperceptions about whether exercise is safe in pregnancy. And it's more of a question of the tiny list of things that women shouldn't do during pregnancy, things that involve direct trauma to the belly, playing tackle football or rugby or mixed martial arts where you're being struck in the belly. All joking aside, it's a good idea for a woman to be able to talk to her pregnancy provider. What's important for all women is to be empowered, to be able to speak up, to share their concerns prior to pregnancy and during pregnancy with their healthcare provider.
Hi, my name is Sarah Eigeldinger. I am a RN BSN on the mom baby unit at Jefferson Einstein Montgomery Hospital. Starting off with the mom, we go through different things that they should be calling 911 versus their provider for, because there's a lot of different symptoms that we do want you to call just in case of an emergency or if you're not feeling well. We give you a lot of tips and tricks on breastfeeding. We really hone in on it, especially for those moms that are breastfeeding for the first time. For the support person, we always ask that they help out our patients here just to make sure that they do feel supported, they do feel loved, and that they have someone along the way to just kind of help them. We always make sure that you go home with resources and supplies that you need. Before leaving the hospital, we do ask that you have a car seat that you bring into the hospital. This ensures that the baby is safe going home.
I always want my patients to know when they have to come back to follow up with us. Car seat's the big thing. I always say, an outfit for the baby to go home in. Really, the nurses are great about giving lots of supplies, so pads, bottles, diapers sometimes a little bit. So a lot of times people do go home with a nice little care package. Just know that we're part of your village and we're happy to help at any time.
My name is Ken Cabone. I'm the chair of OBGYN here at Jefferson, New Jersey. We are currently at Washington Township Hospital. I'm here to talk about how to have a positive birthing experience. I think the most important thing to have a positive birthing experience is to understand that this is your moment. Having a baby is one of the, if not the most important events of your life. You want to make sure that you have met as many providers as you possibly can. If you're going into a group that has multiple physicians or multiple midwives, you're not going to know who's going to be there for your delivery, especially if you come in natural labor. So it's important to get to know your care team. Outside of that, that's where you come in and you make a decision about how you want things to go. Whether you want to be mobile, that's another thing you want to know. Can you ambulate during labor? Can you eat or drink during labor? If you have support people, including your partner or a parent, or if you want to doula, you want to make sure that they're aware of what your desires are. Another thing that you might want to think about getting is a thing called a birth plan, which is something you can talk to your support person about, you can talk to a provider about, and that kind of just breaks down what you might want during your labor. Whether you want the lights bright in the room, you want the lights dim in the room, how many people you want in the room. Again, pain management. We're here to make sure that your experience is as positive as possible. And in order to do that, we have to have an open dialogue between patient and provider.